Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Hematuria means there is blood in your urine. Sometimes the blood is visible. This means you can see it when you pee. Other times the blood is microscopic. This means you can't see it, but a doctor can find it with a test. Hematuria is a sign that something is wrong with your urinary tract. The urinary tract includes your kidneys, bladder, and the tubes that connect them. Hematuria can have many causes. Some causes are mild, like a urinary tract infection or UTI. Other causes are more serious, like kidney stones or bladder cancer. That's why it's important to see a doctor if you see blood in your urine. They can figure out the cause and make sure you get the right treatment. Ignoring hematuria can lead to complications. For example, a UTI that is not treated can turn into a kidney infection. Kidney infections can be serious, especially if you have other health problems. So it's always best to err on the side of caution and see a doctor if you have any concerns. Remember, blood in the urine is a signal from your body. It's telling you something isn't quite right. By understanding hematuria, you can take the necessary steps to protect your health and well-being. Urinary tract infections, or UTIs, are a common cause of hematuria. UTIs happen when bacteria enter the urinary tract and cause an infection. Other infections, like sexually transmitted infections or STIs, can also cause hematuria. Kidney stones are another common cause of hematuria. Kidney stones are hard deposits that form in the kidneys. They can cause bleeding as they move through the urinary tract. Sometimes hematuria is a sign of a more serious condition. This includes bladder cancer, kidney cancer, and prostate cancer. These cancers can cause bleeding in the urinary tract. Other serious conditions like kidney disease and blood clotting disorders can also cause hematuria. In some cases, hematuria is caused by strenuous exercise. This is more common in runners and other athletes who put a lot of stress on their bodies. Usually, the bleeding goes away on its own with rest. However, it's still a good idea to see a doctor to rule out any other causes. Remember, this is not an exhaustive list of all the possible causes of hematuria. If you're concerned about blood in your urine, it's essential to consult a healthcare professional for a proper diagnosis. The most obvious sign of hematuria is seeing blood in your urine. The urine may appear pink, red, or brown. It may also look cloudy or have small clots in it. However, sometimes the amount of blood is so small that you can't see it with the naked eye. Besides visible blood, there are other signs that something might be wrong with your urinary tract. These include pain or burning when you pee, frequent urination, and feeling like you need to pee urgently. You may also experience pain in your back or lower abdomen. If you have any of these symptoms, it's important to see a doctor right away. Early diagnosis and treatment of the underlying cause of hematuria can prevent complications and improve outcomes. Section 4. Diagnosing hematuria, unraveling the underlying cause. Diagnosing the cause of hematuria usually starts with a physical exam and a review of your medical history. The doctor will ask about your symptoms, any medications you're taking, and your family history of medical conditions. A urine test is the next step in diagnosing hematuria. This involves collecting a sample of your urine and examining it for blood cells, bacteria, and other substances. A urine culture may also be done to identify the type of bacteria present in the urine. Imaging tests are often used to get a closer look at the urinary tract. These tests may include an ultrasound, a CT scan, or an MRI. These imaging techniques allow doctors to visualize the kidneys, bladder, and other parts of the urinary tract to look for abnormalities. In some cases, a cystoscopy may be necessary. This procedure involves inserting a thin, flexible tube with a camera attached into the urethra and bladder. This allows the doctor to directly visualize the lining of the bladder and urethra. Section 5. Treatment and prevention, a path to urinary health. Treatment for hematuria depends on the cause. UTIs require antibiotics, while kidney stones may need pain relief or procedures. Serious conditions like cancer may involve surgery, chemotherapy, or radiation. Prevent hematuria by staying hydrated, practicing good hygiene, and making healthy lifestyle choices. Seek medical attention if you notice blood in your urine. UMCC, your Ultimate Medical Consultant connectors.